This visual mnemonic presents an overview of anti-seizure drugs, a crucial aspect of neuropharmacology. Seizures are a complex phenomenon, and understanding their classification and treatment options is essential for effective management. This video will cover the mechanisms of action of anti-seizure drugs, their pharmacological properties, and clinical applications. By the end of this presentation, viewers will have a comprehensive understanding of anti-seizure drugs and their role in treating seizure disorders. Let's begin our exploration of this important topic. Seizure is a neurological condition characterized by abnormal rhythmic firing of cerebral neurons. A chronic CNS disorder characterized by repetitive episodes of seizure is known as epilepsy. Seizure disorders can be classified into two main categories: partial seizures and generalized seizures. Partial seizures can be further divided into three subtypes: simple partial seizures, complex partial seizures, and partial seizures that are secondarily generalized. On the other hand, generalized seizures encompass a range of types, including tonic-clonic seizures, also known as grand mal seizures, absence seizures, or petit mal seizures, tonic seizures, atonic seizures, clonic and myoclonic seizures, and infantile spasm. Understanding this classification is crucial for accurate diagnosis and effective treatment of seizure disorders. This image illustrates the classification of seizures shown in the previous slide in a flowchart. A bedroom with two young boys, a 20-year-old named Gino, a 9-year-old named Patty. Patty is younger and represents partial seizures, while Gino is wearing an Army uniform. He's a general in the Army, symbolizing the second large class known as generalized seizures. The bedroom has a decorative Olympic symbol on the wall. The Olympic symbol is a multicolored ring of circles symbolizing the fact that generally anti-seizure drugs have a heterocyclic ring structure with different substituents attached to the heterocyclic ring. All the features associated with Patty will represent the subclasses of partial seizures. Patty is sitting and solving a puzzle. Puzzles can be simple or complex. This represents simple and complex partial seizures. Patty is wearing a high school uniform. For the purpose of this video, we'll say he's in secondary school. This represents the class of partial seizures that are secondarily generalized. Let's move on to analyzing Gino, representative of the generalized class. Gino is standing beside a petite old woman who is holding an infant. The general standing beside the old woman should help you remember that the following classes are subclasses of the generalized class of seizures. The old woman, or grandma, represents grand mal tonic-clonic seizures. Also, notice the old woman is small and rather petite, representing petit mal absent seizures. Gino is holding an empty tonic bottle. The tonic bottle should help you remember tonic seizures, and the fact that the bottle is empty represents atonic seizures. The old woman can be seen holding a baby. The baby represents infantile spasms, and finally myoclonic and clonic seizures in this class represented by the window in the room with multiple compartments. Let's recap. Patty represents partial seizures, Gino represents generalized seizures, grandma represents grand mal and petit mal, and the room's features symbolize various subclasses. This bedroom is a memory palace, helping you associate each character and object with a specific class or subclass of seizures. This illustration represents the immunostilbene and aliphatic class of anti-seizure drugs, set in a bar named Imnino. Notice the car beside the barman, symbolizing carbamazepine, a key drug in this class. Inside the bar, we see a fat man, representing the aliphatic class of drugs. He's holding a cup of hot liquid with vapor, signifying valproic acid, a drug known for its effectiveness in treating seizures. This visual representation aims to help you remember the immunostilbene class and its associations with carbamazepine, as well as the aliphatic class and its connection to valproic acid. In this gymnasium, we're exploring two classes of drugs. The boxing ring in the center, along with the benzene ring symbols on the wall, should help you to associate this aspect of the video with the class benzodiazepines. Inside the ring, we have four identical quadruplets. They are dressed alike and look like a clone of one another. Clone symbolizes clonazepam. Notice the cat in the corner of the ring? It was flung there by a stray hit from representing diazepam. But now, let's shift our attention to the ox statue outside the ring. This ox represents the oxazolidinedione class of drugs. Notice the horns, one with two colored rings symbolizing dimethadione and the other with three colored rings representing trimethadione. In this barbershop, we're exploring the barbiturates class. The barbershop should help you remember to associate this image with the barbiturate class of antiseizure drugs. Notice the young boy in an elementary school uniform, quietly seated and waiting for a haircut. For the purpose of this video, let's say he's in primary school, representing primidone. On the table, we see a phone, symbolizing phenobarbital. Next to it, the makeshift dotted appearance resembles meth powder, representing mephobarbital. Moving on to the acetylurea class, we have a set of labeled urea cream bottles on the table. Note that a set of urea bottles in this image symbolizes the acetylurea class. The ace card with fern leaves symbol beside it represents phenacimide, a drug in this class. This visual representation aims to help you remember the barbiturates and acetylurea classes of anti-seizure drugs, their characteristics, and specific drugs within each class. Understanding these classifications is crucial for effective treatment and management of seizures. Let's recall the classes of antiseizure drug in this image. Acetylureas, including phenacimide, and barbiturates, including phenobarbital, primidone, mephobarbital. In this scene, we meet Susie, the maid, representing succinimide. She's cleaning mud or earth soil from the floor, symbolizing ethosuximide. Notice her hair, decorated with fern leaves, representing fensuximide. The materials around her are labeled and organized, making it easy to recall the hydantoin class of anti-seizure drugs. The bucket labeled HYDA represents the class, and inside you'll find a bottle, drawing your attention to the wine bottles on her left side. One bottle is labeled Mephin, symbolizing mefenitoin, a drug in this class. The other bottle, labeled Hypin, might look familiar when scrambled. Think phenytoin. This clever play on words helps you associate the drugs with the hydantoin class. Susie's cleaning task and the labeled materials around her make it easy to remember ethosuximide and fensuximide in the succinimide class of anti-seizure drugs, mefenitoin and phenytoin drugs, both part of the hydantoin class. This image illustrates newer anti-seizure drugs and miscellaneous drugs that don't fit into a specific classification. On the desk, we have two miscellaneous drugs, a set of azole drug bottles representing acetazolamide, and the desk lamp signifying dexamphetamine. Note desk lamp. Dexamphetamine. These drugs don't fit into a specific category, but are important in their own right. On the bed, we have a selection of newer anti-seizure drugs. The new prom dress at the foot of the bed represents Progabid. The pen represents gabapentin. The bat stuffed toy represents vigabatrin. The lamb stuffed toy represents lamotrigine, the tiara represents tiagabine, and the shiny top represents topiramate. These drugs are all part of the newer agents category. Through the window, we see lightning, symbolizing the identity of anti-seizure drugs as a whole. Outside, the fallen pole represents felbamate, a drug that may not be as widely used, but still has its place in seizure treatment.